Hello, my name is Marco. I'm going to be doing the trach suctioning on an open system. This was going to be my patient's bed. This is my patient with his trach. I'm going to be explaining everything once I walk into the door, okay? Walk into the room. And this is my equipment. Hello, Mr. Smith. My name is Marco. I'm going to be your nurse for today. The reason for my visit is because we're going to be doing a trach suctioning on you. That way you can feel better and have less discomfort while breathing, okay? I'm going to be placing my stuff over here. Okay, I'm going to do hand hygiene, gloves. I provided privacy by closing the door. Do you have any allergies, Mr. Smith? No? Perfect. So I'm just going to check some orders just to see what the doctor wants it to do. Okay, I'm checking orders. Perfect. We do see we have orders to suction your trach just so you can feel a lot more comfortable, okay? Can you please state your name and date of birth? Perfect. I'm going to check your IV band. Perfect. Everything seems to be in order. Okay, Mr. Smith, I'm just going to get you ready in a comfortable position, okay? Raise the bed. I'm going to raise the head of the bed to a semi-powdered position. I'm going to be placing a towel on your chest just to keep you dry. Okay, I'm going to turn the suction on to 150. I'm going to check the tubing, check the suctioning. It does work. Perfect. I'm going to place it over here. I'm going to put the resuscitation bag next to you as well. And let me see what else we need. I think that would be it. Okay. I'm going to start getting ready with my sterile field. Okay, Mr. Smith? So, okay, this is my equipment. I'm going to open it away from me. Put on my masks. I'm gonna put on some goggles if I have any. I'm gonna open the basin for my normal saving. Right there, touching only the bottom. I'm gonna open my gloves. I'm gonna keep that 1-inch margin as my border. My tubing. So the procedure and the technique is that we're gonna suction your trach on the way out. We're gonna do it up to 3 times or until you can tolerate it. Okay, it's only gonna last 10 seconds each time. We're gonna hyperoxygenate every single time that we finish doing a suction. We're gonna assess throughout the whole time just to see how you're comfortable, okay? So I'm gonna start and contaminate my left non-dominant hand. I'm gonna grab the tubing and I'm gonna connect it. There we go. Now I wanna check my normal saving and lubricate it and check to see the tubing if it's suctioning as well, okay? And I section it, perfect. Okay? Alright, Mr. Smith, I'm gonna remove your oxygen. I'm gonna hyperoxygenate you for a minimum of 30 seconds. Perfect. Okay? And I'm gonna insert it, and then I'm gonna start suctioning on the way out. Okay? So I insert it, then I suction on the way out. Perfect. I'm gonna coil that. Hyperoxygenate you. Okay. Let's start again. way out. Hyperoxygenate. Let's do one more time. Suction. On my way out. Okay. And then I'm going to put the oxygen back on your trach. I'm going to assess. He's doing good. He has no complaints of pain, and he's breathing good. Perfect, Mr. Smith. Okay, we're done with your trach. Now we're going to do oral care and oral hygiene, okay? So I'm just going to suction whatever you have in your mouth, and that way we can remove any mucus or fluid that you have in there, okay? I'm going to clear it. Perfect, with the normal saline. Can you please open your mouth? Perfect, and I'm going to suction whatever I see that's dirty. Very good, Mr. Smith. Okay. Now we're going to provide oral hygiene. And then okay, I'm going to provide hand hygiene. Put on some gloves. Alright, I have here a swab and some toothpaste. And we're going to clean your teeth and your gums. Perfect. How does that feel, Mr. Smith? Good? Very good. Dispose. One last more. Very good, Mr. Smith. And dispose. And that's it. Alright, then let me get this ready out of the way. Trash and linens. Perfect, Mr. Smith. Okay. Do one more. That's hand hygiene. Okay. Make sure and turn off the suctioning before I leave the room. I turned off the suction. I remove the resuscitation bag. I lower the bed all the way down. I put him more in a comfortable position that he wants. I put the collar next to him. I assess. I check his vitals, his lungs, his breathing. Everything's good. He has no complaints of pain or discomfort. All right, Mr. Smith, thank you so much for your time. I appreciate the patience you have with me. If there's anything else, just give me a call, okay? I'll be right down the hallway. Thank you so much. Bye-bye.